there has been an adjustment to the number of cases reported yesterday due to a processing error of laboratory results. The number of cases reported this morning, an addition of 390 cases, was an over-reporting. A number of negative test results were sent to or were processed as if they were positive, and that resulted in an incredibly large number of cases added yesterday. So we were pleased to find that that was in error. The error, we think, has been corrected, but when we reran the data, it showed that 263 cases were added yesterday. So I'm not sure. I'd like to wait until tomorrow before we sort of say for sure that yesterday was the highest number of cases reported in any given day in Mobile. Likely will be, but we'll wait until tomorrow to see if there are additional corrections that will need to be made because of the sort of handling or the routing designation of some of the lab results that were in fact negative that were clicked as positive. So again, it's an automated process when things come through. So if there's a glitch, we generally don't find out about it until we sort of see our daily report and then say, wow, that doesn't look right. Let's go take a look and see what happened. So stay tuned for more on that. And we did report this morning 178 deaths with COVID. That's an increase of 2. And I've been sort of commenting on the number of people in hospitals, in Mobile County hospitals on an average day. We've been averaging around, earlier in the week the numbers are lower and then they sort of build toward the end of the week, but on average there are around 150 patients with COVID admitted to Mobile County hospitals at any given day. Yesterday, the hospitals reported that there were 190 currently hospitalized with COVID disease. So I have quite a few questions and things that I want to clarify. Someone on, I believe it was Tuesday, asked about something, and I didn't get around to addressing, but I'll try to do that now. Let's see. Asking about, regarding the new CDC guidelines as to when someone is asymptomatic and return to work. So let me restate this again. The 2-test-based strategy, or any test-based strategy for discontinuing isolation or quarantine. So this means, to get a negative test so that you can return to work or return to school is not recommended. So we are not recommending testing to discontinue isolation and quarantine for anyone. Anyone with a COVID positive test, whether you're symptomatic or asymptomatic, must isolate at home for no less than 10 days. If you do have symptoms, you have to stay at home for at least 10 days, and the last 24 hours of your isolation has to be symptom and fever free. So if you still have a fever on day 10, you have to stay home another day and another day until you have at least 24 hours with no symptoms in isolation. But if you are COVID positive and you have no symptoms, you must stay home for 10 days. And then people with close contact, so close contact means within 6 feet for 15 minutes or more to a person who has PCR COVID positive, whether they're symptomatic or not, must stay at home for 14 days. And if you're wearing a mask during that close contact, that does not keep you out of having to quarantine. If you're within 6 feet for 15 minutes or more, you must isolate at home for no more than 14 days. So if someone in a household tests COVID positive and they've been sleeping under the same roof as the rest of their family and not maintaining that 6-foot distance, it means that the COVID positive person would have to isolate for 10 days and the rest of the family would have to isolate for 14 days. Now this time of quarantine can be extended if the COVID positive family member is symptomatic, because basically the household members are continually exposed as long as the COVID positive family member is symptomatic. So in that situation, once the COVID positive had reached 10 days and when they were fever-free and symptom-free for 24 hours, that is the day that would start the 14-day clock for the rest of the family. There are some great online tools for helping you think through these different scenarios, and we'll be sure that some of those are available to you because it is not straightforward. It is somewhat complex. So in addition, I mentioned that anyone who tests positive for COVID should not retest for at least 3 months because of this problem with persistent positive testing and being, persistently detecting virus that is no longer viable to infect and cause disease in another person. All right. Someone was asking about that Vice President Pence said children without a serious underlying condition have very low risk of serious outcomes to the coronavirus. Is that correct? Yes, that is correct. Most children will be asymptomatic or have very mild illness. Only those that are severely immunocompromised or have severe underlying conditions will have complications of COVID. Here's another, just did that one. Okay, we'll move on to another one. So someone asking that it appears that Mobile County and City are not trying to enforce the COVID guidelines. The Mobile County Health Department has no enforcement authority over businesses and people. We do have some authority over permitted establishments, so restaurants, tattoo parlors, pools, things of that nature, but we do not have any enforcement authority over businesses or people that are not complying with the Safer at Home order issued by the governor. And that ordinance, like the mask ordinance, for example, that is an order to individuals, not to businesses. So no one, even the city of Mobile or the city of Saraland or any other city, if they've issued a business license, there's no enforcement, that's a part of this order because the order applies to individuals, not to businesses. So the businesses, if they are not complying, there's really no enforcement that can happen with that. And also someone just sort of wanting to tell us what a poor job we're doing. We hear, on both sides. Get lots of emails and text messages saying, thanks for what you're doing, we appreciate the info, and then just as many of you are not happy with what we're doing and wish that we were doing something different or doing something more. So we will continue to receive your comments and thoughts. Okay, here's something on the media wanted to ask about the huge jump and wanting to know when, what was responsible for that. So I explained that in the beginning, part of it was due to a processing error. So again, an error in the automated processing of positive and negative laboratory results. Some negative lab results were processed as positive lab results. And then when will we start reporting hospitalizations? So we have been saying daily, at least when I give the report, the number of people currently hospitalized. So again, for today, or for yesterday rather, again, the reporting is a day behind. There are 190 people yesterday hospitalized with COVID in Mobile County. We're switching our source of hospitalization data. Previously, we were using investigations from the lab reports, but the system is so overwhelmed with the number of lab reports. We know that those data are incomplete. So we are going to switch to reporting data on patients that are reported to Ames, and we've been working on it. We're going to try to begin with our weekly report on Monday, providing demographics of the information on hospitalizations provided into Ames. See, here's someone else from the press asking about the spike in the numbers yesterday. Again, even with the adjustment down, if 263 is our number for yesterday, that greatly exceeds the highest number of cases reported to us on any given day. Prior to this, the highest number I believe was 209 and had been adjusted down to 203 or 202 or 201. So somewhere right around 200. So if yesterday's number is in the 260s, that is still, yes, a great concern at this rapid acceleration of the number of cases that we're seeing. Someone asking if we are seeing deaths in younger generations. We have seen a few, like can count on my hand, the deaths in people less than 50. I think we have 2 deaths in people less than 40, but these were people who had severe underlying medical conditions and who were at great risk of complication and death from COVID infection. And in general, deaths will, some people refer to them as a lag indicator, excuse me, because, you get infected, then you get tested, then you become sick, then you get hospitalized, then you die. So the number of hospitalizations and deaths lags far behind a positive laboratory result. So when we see spikes like we started seeing last week of things really starting to increase, then we expect to see the number of deaths begin to increase in about 14 days. All right. Here are some comments or questions from Facebook. Someone wanting to know if they wear a mask and stay 6 feet away and keep their hands clean, how will they be spreading it? Well, if you stay 6 feet away and you keep your hands clean and you wear your mask, then you are not spreading it, which is what we want you to do. Sometimes it's difficult to maintain that 24 hours a day. So we know that people are human and they slip up. So there are still possibilities that you might transfer, from a surface to your face, but you will greatly reduce your risk if you stay 6 feet away, keep your hands clean, and wear a mask. Also cover your cough, stay at home when you're sick, and disinfect surfaces frequently. All right. In order for schools to reopen, so I think we've already had this one. I think I answered this a couple of days ago. Someone was asking about, there have been school systems in Mobile County that have decided to remain closed and only return with distance learning, and they have, reasons behind that. We have other schools that have decided that they can reopen safely, reopen schools. We've been consulting with many of them that have decided to do that. It is true that we are in an extremely accelerated phase of community widespread transmission, and it is concerning. There are some guidelines for reopening, but they're not mandates. And so school boards and superintendents and advisory panels all over the county are trying to decide, make decisions for their schools, and we support them in a consultative role. Let's see, a question about quarantine. If a restaurant employee tested positive and worked within 6 feet of employees before finding out, should they be quarantined? Yes, they should be quarantined for 14 days. They should be sent home from work and they should stay at home for 14 days and monitor themselves for symptoms. They should not be tested for COVID. If you test for COVID with just exposure, it is most likely will be a false negative result if you get a negative result. There's no recommendation right now for testing if you are considered a close contact. That is a really big change from where we were a couple of weeks ago, and the science is part of that change. The availability of testing is part of that change. So if you are exposed to someone with COVID-19, you have to go home for 14 days. Do not test. Stay at home for 14 days. Monitor for symptoms. If you become symptomatic, call your healthcare provider. And then there are circumstances where a test might be recommended, but then if you do test positive, the length of time that you have to stay at home needs to be extended because you are still infectious. I'm closely exposed to someone who tests positive. What's the protocol? I have no symptoms. So again, if you are exposed to someone who's COVID positive, go home for 14 days and stay there and quarantine yourself, monitor yourself for symptoms. Someone, again, trying to spread the conspiracy theory that people who are tested more than one time are recounted. That is not true. someone's stating that false positive tests are the problem, and the only problem with false positive tests are people who get tested serially after a true infection. If you get infected with COVID-19 with a positive test, do not retest for 3 months. If you test greater than 10 days later, if you test it 2 weeks and 3 weeks and 4 weeks, those positive tests are only detecting viral particles. They're not detecting virus that can replicate if it gets into into a human. So that's the only scenario for false positives, is people being tested multiple times after their initial test. And the recommendation is to not test for 3 months. Someone who tested positive in the morning and negative in the afternoon. So I don't know why they would get 2 tests in one day. That is certainly a departure from protocol, and it depends on which test was counted as to which type of test was performed. We do not count positive antibody tests. If you get a negative on a platform called Sophia, that has to be confirmed with a PCR test. So it's not just as simple as it may seem when you're chatting around the water cooler with your coworkers. So the last thing I wanted to do, just to remind you that we are still in an extremely critical phase of our outbreak. Our cases continue to go up and up and up. I hope the adjustment from the processing error makes things look a little bit better, but I'm not hopeful. And we've been seeing some modeling coming out of some researchers at UAB estimating the number of people hospitalized for COVID each day in Mobile. And right now we're at about here, where we have about 190 hospitalized today, and this is July the 23rd. And these are their projections for into the first week of September, that we will more than double the number of patients with COVID in Mobile hospitals between now and the first week of September. So I can't emphasize anymore how important it is for the community to come together to try to protect each other, to try to slow the spread, to prevent overwhelming our healthcare system. And you can do your part, take on your personal responsibility for protecting our community by keeping a physical distance of 6 feet between you and anyone who's not in your household, wearing your face covering, covering your cough and your sneezes, staying at home if you're sick, wearing your cloth face covering when you're in public where it would be difficult